Hi everybody, my name is Vern Rondo. I'm a nursing student with Gonzaga University, and today I'm going to talk to you a little bit about my personal philosophy of healthcare and nursing. Um, this is a difficult subject to articulate because it has more to do with how I act than how I think, and the things that drive me to do and practice the way that I do. So, in order to get a better idea of what exactly a philosophy is, to pinpoint it down so I could articulate it better, I did a quick Google search and found that it's loosely translated as the love of wisdom. And so, what I what I want to do is articulate how I practice from a philosophical standpoint, and the main the undertone to what I do and how I think is that as a nurse, I have the responsibility or the opportunity to help somebody in the situation they're in to get better. And in this case, it's better mentally and physically, or in the sense of their health. And this kind of this mantra to help people comes right in line with James 3:17, which says, "But the wisdom that comes from heaven is first of all pure, then peace-loving, considerate, submissive, and full of mercy and good fruit, impartial and sincere." So I think this is a good way to summarize my approach, or what I try to have as my approach to nursing. I've been a nurse for 7 years, and I started my career working night shift with one other nurse and a CNA at a small critical access hospital. And as a nurse there, I was involved in things that were perplexing, involving chronic illness and acute injury, infants. I saw a lot of things that I'd never, if you'd asked me 2 years before, I would have never known how to handle or what to do. And I found that in my most difficult times as a nurse, the thing that I fall back on is that there's something that I can do to help the situation. That if I approach it with uh, peace, love, consideration, be submissive, not forceful, full of mercy, remain impartial, which can be very difficult, and also sincere. Sincerity is, I think, the cornerstone for the philosophy of helping other people. That you can have all the information you want as a healthcare provider, but if you can't present it in a way that is sincere, that you genuinely want what's better or best for the patient, then it's my experience that you usually don't get as good outcomes as you could if you take that same information and you invest in the patient and build a relationship as people, and then use that relationship to speak into their lives in a positive manner, in a way that's going to um, help them improve their health. Uh, so it's hard in thinking about the philosophy of nursing and healthcare to differentiate that with my personal life. I appreciate different people in different walks of life because I have people near and dear to me who come from those same walks. And so I make sure to be aware and cognizant of my preconceived notions and to kind of check those at the door so that I can go and do my best to take care of patients and not have a partial view, that I am sincere and impartial to helping them do the best that they be the best that they can be. Health is something that's multifaceted. There's a lot of variables that contribute to healthcare needs of a person or a population. Currently, I work in a Native American community, and there's a lot of um, complicated variables at play for them individually, as family units, and as a culture, um, from high incidence of certain chronic illnesses to food insecurity to historical trauma. There's a lot of variables that impact their overall health, and I try my best to approach each person and treat them as an individual, um, with something to offer and with a positive outlook, rather than somebody who is um, oppressed by historical trauma or um, poverty or whatever the case may be. And so, relating the circumstances that I see now clinically to the circumstances that I saw when I was working in a hospital setting, I realized that there's overlap, and that overlap is my attitude and the way that I treat people. And so, again, it kind of comes back to the philosophy or the idea that everybody has somewhere where they can improve and somewhere that they're doing well. Um, I'm a firm believer, and I test this frequently, that some of the most difficult people that we have in our practice or in our community, even on some level, I can relate to them, whether it's as a son or a husband or a brother or a father. That there's something that we have in common, and that there's, even in some of the hardest patients, there's a thread of good, um, and that if you can relate to them on a personal level and develop a relationship, then you can develop a platform to speak into their life and help them to get healthier. Um, so, from a philosophical level, I want to help each person realize the healthiest person that they can be, and then obtain that goal by nurturing and developing the relationship. And this relationship allows me to tell them the good things that they're doing, but also to give them the constructive criticism that they need to continue to improve their health. This falls right in line with patient advocacy, in the sense that sometimes patients need to hear the things that they don't want to hear. And sometimes patients don't know what information is coming at them. They're daunted, and they're not in a field or an area that they know about. So they take, I see the nurse as somebody who is there to provide professional accountability to other healthcare um, workers who are part of the healthcare team, to make sure that we're practicing to the best that we can. I also see it as somebody who works with the patient, develops that relationship so that you can go and do the very best that we can to elicit a change. And so, again, I've worked in the hospital setting, I've worked in the clinical setting, and I feel like there's the opportunity in nursing, um, at least in my experience of the places that I've been, that if you take the time to get to know somebody and to relate to them and build the relationship, that relationship gives us an investment in those people. And you don't see them as a diagnosis, you see them as a person, and you can relate on some level with what their needs are. And beyond that, it gives us a platform to be able to take evidence-based practice and good medicine and bridge the chasm between that information that we know to be true and that directs the patient care across the healthcare spectrum, and translate that into something that would work in the lives of the people that we're helping. And so, um, like I said, it's kind of hard to articulate what exactly my own personal healthcare philosophy is, because as much as I know it and I practice it, it's hard to put into words. It's something that comes out with each person and with each opportunity. But the undertone is to find a way to do the very best that I can for that patient, to advocate for quality healthcare, um, to be accountable to my patients, that I know what quality healthcare is, that I know evidence-based practice, and that they can trust me as a member of their healthcare team to piece together and be there to ensure that they are receiving good care, um, and that means timely care, quality care, and personal care, so that at the end of the day, they've got the tools from us as healthcare providers to become as healthy as they can be. Um, so thank you for watching this. Hopefully it makes sense. And just going forward, I'm going to continue to practice medicine in a way that's the most beneficial to the person in front of me, to the people that I'm helping, and and take it one patient at a time and develop that relationship and continue to move forward in the information, um, obtaining information so that when I have that relationship, I can give them the best tools possible to understand what they can do and what we can do together to make them healthier. Thank you.